String no question. That's the time is up.
महीने के पैसे दिए हुए उसको।
Good afternoon, everyone. I am Dr. Tanu Kukreja, HR School of Teacher Education, Om Sterling Global University, Hisar. On behalf of entire university, I extend my warm welcome to all of you to this webinar on mental health issues in special education. For this session, we have amongst us Dr. Dipali Batra, founder and director, Pulse Clinic, and senior consultant psychology, clinical psychology at Max Hospital, Delhi. We have our very own Vice Chancellor, Professor Dr. Ajay Podarji with us, and Professor Shobna Podarji, Professor Management and Dean Corporate Relations and Training, Home Sterling Global University, Hisar. So to begin with, I would like to invite our Honorable Pro Vice Chancellor, Dr. Ajay Podarji, to share his words of wisdom and deliver the keynote address. Over to you, sir.
Thank you, Dr. Tanu, and officially welcome to Ms. Dipali ji for taking this session on this platform of university. I am very happy that today you have taken some time to give the wisdom and the knowledge of the modern tools and techniques what is actually going on in this subject. And since the subject is very near to the socialistic approach, I believe that the students and the faculty they will be definitely having the advantageous approach while they will be joining this session. I hope that many participants and faculties are already have joined on the YouTube. Ms. Dipali, you might not be able to see the participant because they are actually on the YouTube, and here we only see the speakers because the number of the participant goes very high, and nowadays the platform is not allowing more than 100 participants. So with that, from the university side, officially welcome to you. And I am also eager to listen to you in the next 45 minutes. And thank you very much for joining us. We will be eager to listen to you. Thank you, Dr. Tanu, please.
Thank you, sir, for sharing your thoughts and taking out time to speak to us today. Now, may I request Dr. Shobna Podarji, Dean Corporate Relations and Training, to speak to the audience.
Thank you, Dr. Tanu, and we are really happy to have Dr. Dipali Batra, Director Pulse and Senior Clinical Psychologist from the Max Super Specialty Hospital, Delhi. Welcome, ma'am, here. And you know, it's really a very good us to listen about that. She will be discussing about the mental health issues in children with special needs. And as we know that children with learning disabilities often experience behavior problems related to reduce, the self-confidence and increase anxiety and stress. And other symptoms such as aggressive behavior and social isolation were also common. So special educational need and disabilities can affect a child or, a young person ability to learn. They can affect their behavior or ability to socialize. For example, they struggle to make friends reading and writing, and they should, feel good about in different aspects in life. Learning disabilities may feel like a failure, and this can cause them to stress out. So in this way, we are very happy that we are able to listen about the issues and how we can overcome about the same. Over to Dr. Tanu and to the ma'am. Thank you.
Thank you, Dr. Shobna, for sharing your thoughts, ma'am. It's a matter of sheer privilege that we have with us Dr. Dipali Batra ji. Dr. Dipali Batra is founder director of Pulse for Children and Adults and the senior consultant clinical psychologist at Max Healthcare, Delhi. She has been working in this area from last 14 years and is registered with Rehabilitation Council of India. Dr. Batra has been awarded Best Performance in School Psychology Award for her contribution in the field of school psychology in the year 2014. She has been also felicitated with Child and Adolescent Mental Health Award in the year 2018 and has been invited as a resource person in prestigious institutes like National Institute of Mental Health, National Institute for Empowerment of Persons with Multiple Disabilities, State Council of Educational Research and Training, amongst many. Dr. Batra has trained various school principals and teachers in areas like learning disability, behavioral problems, risky behaviors like suicide attempts, etc. You must have read her articles on various psychological issues in the national dailies like Times of India, Hindustan Times, The Asian Age, Deccan Chronicle, Mumbai Mirror, Navbharat Times, etc. Or watched her in her several shows of national TV's channels like Z TV, India TV, NDTV, ETV, etc. Dr. Batra, it's an honor to have you here today. May I please request you to address the audience? Thank you.
Thank you so much. Thank you for having me here. I'm really happy to be a part of this webinar. I think during pandemic, we all have learned this way of learning and reaching out to people. And with this way, we have been able to reach out to a lot of people and have been able to put across our perspectives. I would really suggest the audience to engage actively in the chat section so that we are able to make it an interactive session and be open with your questions or queries or any inputs that you would like to add on. So with this, I would like to give a short presentation. I'm just sharing the screen. So I would like to talk about the mental health issues in children with special needs. Now, why are we here? I think all of us understand that mental health is one area which is really neglected, and especially when we talk about children with special needs, that's one group that suffers the most because the focus is somewhere else. Most of the times, the focus of the professionals is on improving the other abilities and not on the emotions. So here we'll be sharing some knowledge, and we are going to talk about an area which is hardly talked about. The aim of this presentation is that we'll be trying to bridge the gap. We'll be targeting the primary caretakers, the parents, the teachers, and we'll be sharing the knowledge. Now, so is the screen visible? Am I audible?
Yes, yes. The screen
Yeah.
is also visible and you are clearly audible.
Okay. Okay. So, I'll just start with a small thing that, a very basic thing that most of the people see how we label a child, that whether that student or child is a good student or a bad student. Now, how do we decide that whether this student is a good student or a bad student? Basically, a good student is somebody who has regular attendance, is disciplined, has good hygiene, focused, smart, brings good name to me or good results. Now, a bad child is perceived as a child who has poor grades, is inattentive, irritable, losing articles, picking up fights, and has bad results. Now, I see usually that a lot of people see children in good or bad student. Now, is everything so black and white? First of all, we need to understand, is it so is it so clearly black and white? Because commonly we see a good student who writes a bad exam, an irregular student attains good grades, a smart child making foolish spelling mistakes. Now, what is behind the so-called bad students? Intelligence, low IQ, learning disability, ADHD, ODD, other physical disabilities, visual or auditory concerns. So there are n number of things. So usually when we see that a pattern is recognized, we usually pre-referral the school or the teachers. They check the students' records, they get the feedbacks, they sit with the parent, they talk to the parent, they start the communication, then the child is referred for evaluations or assessments to a mental health professional or a clinical psychologist. Now we have to understand one thing clearly, that when I'm talking about mental health specifically in children with special needs, I'll now make a very common statement for all children, so called all children who are okay, that stressed out students can't learn. Now, there are three major areas we need to focus on, which is biopsychosocial model. We have to understand that our genetics play a significant role in terms of our when it comes to our learning as well as our mental health. So, a genetic condition can cause a range of other physical, cognitive, behavioral, and mental health issues. Then comes the psychological part, the psychological model of biopsychosocial model, that a child's experiences shape their personality development, approaches to life, locus of control, confidence, self-esteem, and coping strategies. So we have to remember that a child who has gone through a difficult experience in the school setup or at home or somewhere else, obviously it will have an impact on his or her mental health. Like, for example, former experiences of abuse, neglect have been shown to predict incident episodes of mental health problems. Then, obviously, the social model, the social and environment factors are likely to influence and mediate the development of mental health problems in people with learning disabilities. Now, when a child has a learning disability or any other disability, the primary focus of the caregivers and the educators is usually on the academic success. Learning disability may be affecting the child's emotions as well. Can you write in the chat section that does it happen that a child who has special needs, his or her emotions may get affected? Do you think that the emotions may get affected because of the kind of disability that the child is going through? Can you write yes or no in the chat section? Okay. So, when a child comes to us and we go for any sort of assessment for learning disability, for ADHD, we usually see that a child is not speaking much initially. A child is quite hesitant. A child may be again and again asking that, "Ma'am, am I doing right? Ma'am, how many mistakes have I made? Ma'am, are you happy with my performance?" We usually see some children asking for reassurance. And that is where, we get those signs of a kind of emotion which is affecting the child, where the child wants to listen that, yes, you are able to do it. Yes, the child would need constant reassurance because the child has heard so much about himself or herself that he or she now looks for approval. Now, there lies in the child need for a sense of identity. So you will see that rather than be labeled the dumb kid at school, the child would attempt to be labeled as the bad kid. Because if you're labeled as naughty, that the child perceives this as less vulnerable rather than being labeled as a dumb child. So alternately, some children attempt to become the class clown. Now, here are some common problems with children with disabilities face. Children perceive themselves as being stupid because they have heard it so many times. Children feel like the odd one out in class. Children become worn out. Some children who would come to me would say that, "Ma'am, if we get this assessment done and if something comes in my report, this also would indicate that I have a problem, and then I'll be made to sit separately and I'll be called a special child. So, ma'am, how is my assessment report? Will I be able to perform in a better way?" So some children become very conscious because they know that, something which will come in the report will uh, it will affect how other people perceive them. Now, many children have feelings of disappointment. They are unable to follow the pace, leading to feeling bad. There is too much of correction from the environment. Like, they are constantly told that you can't do things properly, you're a failure, you are so slow. Look at other children, they are better than you. Why are you here at our house? So sometimes, the child keeps listening to this criticism, and which makes the child believe that he or she is completely worthless. And I think this is one area which really nobody talks about, because most of the people are concerned regarding the scores or the academic achievement. So why a child doesn't talk at all when he or she enters the assessment room, or when the teacher is asking something, that okay, you speak one statement about a particular topic, and the child is not able to speak. So it is not just because of the disability, it is also because of low confidence. It is also because of fear of feeling that I can't do it right. The child starts believing that he or she can't do anything right. Then again, bullying is common. School refusal is common. Some children stop going to school because they fear going to school, because they feel that if they go, they will be called names. Their peer group may laugh at them, or they may not. Nobody would want to sit with them. So many of them feel inferior. Now there is failure in social conduct with some children. Some children can perform something well, but they can't explain it verbally, especially in front of others. Some children have excessive shyness, and some of them have lack of confidence in self in social situations. Now it's really a difficult thing for a child. And the impact that we usually see, that some children who have gone through these experiences, they isolate themselves from the society. They feel ashamed of themselves. They have fear of failure, criticism, rejection, to an extent that the child tells me that, ma'am, I fear speaking, because if I speak A, I'll be scolded. If I speak B, I will be scolded. So I don't know whether I should speak or I should not speak, because I've started believing that if I speak, it will be wrong all the time. Then obviously children are discriminated, because there is a constant comparison going on, that the an ex child has got into this college, or an ex child has got into some other maybe university, but you would not be getting anywhere, whereas this child is only in 7th or 8th standard, and he's compared to another child who is 18 plus. So I think that because at times parents or caregivers have some anxiety related to their child's future or performance. So this anxiety is displaced onto the child, and the child also starts feeling the same emotions. So feeling lonely, not having peer group. Now we also need to understand that what we don't know, we don't see also. So because of lack of awareness, what happens is that parents don't know what the child is going through. So they start thinking that if their child is not able to perform academically fully, then their child is a failure. They start jumping on conclusions, because they are not psychoeducated well, because they do not approach professionals, because many of them don't know where to go, whom to go, what to talk about, whether it is a matter of concern or not. So many years pass, because a lot of times people think that as the child would grow, things would improve automatically. So it is because of lack of awareness that it takes years for people to approach somebody. Now, whose responsibility is this? That is one. Is this the responsibility of a parent or a professional? Now, we usually feel that it's a multidisciplinary approach. So if a child comes to us for psychoeducational assessment, ideally, even if it is a psychoeducational assessment, we usually recommend that do assess the emotional area, because the child's low self-esteem, low self-confidence may also affect the child's performance in the assessment. So assessment of emotional problems, how many of us do that? Do we actually spare some time and sit with the child and ask the child how is he or she, what he or she feels about his or her performance, how is the home environment? Is this something which should be taken into consideration? Because I think it's a very quick fix thing. We usually assess reading, writing, spellings, IQ, and some approach which is very mechanical. A child is asked to learn things and then perform during the examinations, and where is the emotion? Are we asking how are you? Were you able to sleep properly? Are you feeling bad, or are you okay? Do you want to talk about something? Do we reassure the child that I'm there? So, can emotional problems affect test results? I think yes, it does affect. Like, suppose if, even if as adults, you can, we all can just self introspect that if we are emotionally feeling bad, if I'm low today, it will affect my performance. I'll not feel like doing anything. I'll not feel like engaging in any activity. So, obviously, if a child is emotionally not okay, if the child's emotional well-being is affected, obviously it will affect the child's test results. So there are certain ways in which we do assessments, where we can use tests. Like, one is informal assessment, then there is another test. The name of the test is child behavior checklist. Then there are tests like sentence completion test, children apperception test. Then there is another test developed by Dr. Masroor Jahan and Dr. Amol Ranjan, who are at RENPAS. It is RENPAS Family Relations Test, a projective test for children. So I usually use this test at my center because this is one test that helps me to understand the child's state of mind, how the child perceives the father, how the child perceives the mother's behavior, how the child perceives siblings' behavior, how the child perceives grandparents' behavior. It helps us get an insight of the home environment, the dynamics inside the family system, and the child's perception of that. Because a child who is referred to psychological services usually has some basic disturbance between self and his or her environment. And I usually see that children who have special needs, whether it is a hearing issue, or sorry, it is an auditory issue, or it is a visual issue, anything related to that, it affects the child's mental health. And these are certain areas that are really ignored. I think all of us understand, because the focus is that as soon as we can start the intervention for these disabilities, better it is. But where is the emotion? Working with children, obviously, it has to be less verbal component. We give more significance to storytelling, painting, artwork, play method, because children usually talk about things when they are engaged in certain play methods. Now we have to understand that when I sit with a child, suppose I'm sitting with an adolescent with some disability, um, the issues for them are that they are going through some developmental changes, that they feel that they are being blamed, that they are being doubted, that they are going through pressures of different kinds, and they have limited coping abilities. Now, issues for parents that we usually see, issues for us, academics, that the child is not able to perform academically, the child is not performing like his or her uh, peer group, moving that my child is moving away from the family, or my child has habits or some weird interests, or my child has some emotional outbursts, or the child is is giving a lot of time to mobile or internet. So where is our blind spot? So we have, because maybe we are unable to understand that we need to acknowledge their position, that that they are at a different stage, appreciating their efforts, showing trust in them. At times, people let ego come in, and we at times fail to identify the signs of disturbance. We feel that it is for the time being, it will not stay for long, it's just a temporary thing. And the child would keep requesting the parent that, see, I want to go to somebody, I want to talk about things. and especially a child who is suffering, who has gone through a difficult experience at school or in the playground or at home, would really want to talk about it to somebody. Now, the strategies that we usually suggest that should be used in the classrooms are that we need to provide the immediate feedback to the child in the classroom. We need to break down long assignments, that we should maintain constant communication, that we allow child the time to respond, because at times, due to paucity of time, we usually tell the child to respond faster, that tell it fast, read it fast. And this fast things creates a kind of confusion, discomfort, um, and the child then starts fumbling and is unable to respond. Setting priorities, we need to take into account the students learning style, and we need to make sure that learning materials are available, because we also need to ask ourselves that why is it that a child opens up to a mental health professional more than to his or her caregivers? Why is it that the child starts feeling that the mental health professional is somebody who would not judge me, but my caregivers would judge me? Why is it that the child feels that kind of fear of criticism, from the caregivers, and he or she feels that he or she can be easily open up to a mental health professional? There must be some difference, and we need to work on this area. And for this, I think we need to psychoeducate the caregivers. I'm not saying that they become completely non-judgmental, but having an approach where their child perceives that he or she is heard, that he or she is understood. So what can be done? We need to start acknowledging, accepting, appreciating the child. We need to involve and indulge, wherein I really suggest parents to only maybe just take out 15-20 minutes each day and engage in some activity with your child, whether it is an artwork, whether it is cooking, whether it is playing some board game, where you are not distracted by anything, you're just with each other, and your child is just allowed to be himself or herself, so that there is no cover and the child can be playful with you. Trust, conveying empathy, offering support, guiding and encouraging the child. So there are certain warning signs that we need to look into, when we see a child with mental health concerns. If you see constant mood changes, if you see intense feelings, behavior changes, difficulty in concentration, unexplained weight loss, physical symptoms or signs of physical harm, or substance abuse. So I think that these are certain signs that are warning signs, and we need to reach out to professionals and work on those areas. So psychoeducation is my first step. Second is that we need to handle the crisis. We need to have play therapy, support work, and if required, CBT. So all our kids need is a little help, a little hope, and someone who believes in them. Thank you.
Thank you. Audience, if you have any questions, you can put in the chat box, and ma'am is here to answer, to take your questions. Though there are no questions yet, but there have been a lot of wishes and appreciations for you, Dr. Batra, here in the chat box. A lot of people have put that it is a very informative session, and thanking you for that.
Thank you.
All right. Okay, so I wanted to ask you something personally. So I've written my question. The emotional challenges, are faced by all the children, and especially when we talk of children with special needs, it is even more. So what can be done at a very basic level in our homes so that we as a parent, we as a guardians, don't emotionally traumatize our children?
See,
So
I
we
think no
use,
parent, yeah,
yeah,
understandable. See, no parent would ever do it intentionally. I think it just happens. The intention is not wrong, but the ways, the methods that are used to handle that. So I think that is where I said that awareness is really important, where people get to know what these disabilities are and how, when you're suffering from something like this and you have limited resources, like during COVID times, the mental health concerns in children with special needs um, um, have gone up during these times because there were limited resources. The interventions were not they were not able to take regular intervention, and obviously because of
True.
which the child suffered and the whole family suffered. The first thing that a
Right.
parent, I think, should understand is that they need to regulate their own emotions first, because suppose if they
True.
are going through their own crisis, maybe in their career or in their personal life or anything to do with self, and then having a child who is suffering already, so obviously all this would get accumulated. So working on your emotional management, your own emotional regulation is really important, where you have your own me time. You're engaging
Right.
yourself in certain activities of your own interest. You're taking breaks. You are
Mhm.
not just, you're not blaming yourself for your child's condition.
Right.
You are using to the point specific statements to give
Mhm.
some instruction or to give some message to your child, rather than using a lot of statements, because when we
Yeah.
say a lot of words, certain words really damage, because because the child is
Yeah.
already sensitive, and then the child can pick up
Mhm.
certain statements and that may affect the child.
Right. And I think
So
we use a lot of,
yeah, please continue.
yeah, so I think we use a lot of you statements as well. You did this, and that directly hits the ego of the
Exactly. So
child.
using more
Yeah.
of I statements. I feel
Right.
this. I feel you have done this, so I'm happy. I feel you could
Right.
have done this, or I feel that you
Mhm.
tried best. So using more of I statements. Also, I feel that in special education courses, I know that mental health is taken up, but usually
Mhm.
when somebody takes a child with special needs, a special educator is teaching a child maybe phonetics or anything
Mhm.
else, or maybe helping the child to write. So I think that we need to take into consideration the mood of the child, the emotion of the child, because if I'm low, I'll not be motivated.
Mhm.
If I'll
Right.
not be motivated, I'll not do what you're making me do, or maybe I'll do it in pressure, but I'll not do it the way it can be done. So I
Agree.
think we also need to be more mindful, as if somebody is a special educator or a psychologist, that is the child in the right state of mind? Is the child
Mhm.
motivated? Is the child enthusiastic? Does the child
Mhm.
wait for me before the class?
Right.
Or does the child feel that now here again another 30-40 minutes of the same reading, writing, and all those things, because they have already been
Mhm.
struggling. So they need now somebody who is more playful with them, who
Right.
accepts them the way they are. You would all, I think we
Mhm.
all remember that we all had our favorite teachers in schools.
Yeah.
And who was my favorite teacher? Our favorite teacher, I think, was somebody who was accepting, acknowledging,
Kind,
respecting,
loving. Yeah.
loving, caring, less
Right.
judging, more
Yeah.
patient. So I think
Hmm.
that these are certain skills that are required. Techniques, I understand the techniques are important, but techniques would work only
Hmm.
when these skills would be present. That you're accepting the child unconditionally. That you're not
Yes.
putting a deadline on the child.
Hmm.
So
True.
the child would go to a teacher or to somebody who they feel is accepting. I may
Yeah.
perceive that I am too soft, but the child may perceive something else. So I think that's one
True.
area we need to work on. And if a child has given us a message that the child is finding a kind of discomfort, we need to work on that
Hmm.
instead of feeling bad, offended,
Hmm.
attacking the child. कि तुमने ऐसे कैसे बोल दिया? How can you talk like this about me? I have done
Hmm.
so much for you. So many times people also induce guilt in the child.
Right. Hmm.
So, so there are a lot of dynamics around this. And then when a child comes here, they take time to open up, because even if I tell them that okay, I'll not share it with anybody, they feel that it'll be shared, and then when they go back home they'll be scolded.
Right.
So that is why we need to educate the parent that they have to trust the professional, and the professional needs to take the emotion first and then something else.
Right. Right. I agree with you when you say that we have to be unconditionally positive and loving towards the child, and also heal ourselves without before we begin to heal our children. We need to regulate our own emotions
Definitely,
before
definitely.
that. Right. Thank you so much, Dr. Dipali, for taking out your time. I know your schedule remains very busy. And thank you for sharing what are the some key mental health issues in children, and especially children with special needs, and what we can do about it at a basic level in our homes and classrooms. Once again, thank you for joining us.
Thank
And
you. Yeah.
Thank you, ma'am.
Thank you, ma'am. Okay.
thank you. May I request everybody to rise for national anthem now?
जन गण मन अधिनायक जय हे भारत भाग्य विधाता। पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा। विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा। तव शुभ नामे जागे तव शुभ आशीष मांगे। गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे।
Thank you everyone for joining us.
Thank you.
We call
Thank
it a
you.
day now. Thank you.